primary role as a veterinarian at the zoo is the health of our animals. We're also involved in clinical research that can improve the welfare and lives of our animal collection. Involved in this a little bit is also reproduction, and the veterinary team is highly involved in the reproduction of our animal collection. This can vary anywhere from harvesting semen from endangered animals to inseminating the females, and then also supporting the mother and the baby during the parturition and the eventual growth of the baby. The veterinary team is involved in two projects right now. One is the introduction of a spiny soft-shell turtle that's native to Quebec, and also little brown bats that are native to Quebec. The veterinary team is involved in that aspect. Maybe in the future we might also be involved in more larger scale reintroductions of some of our endangered species, such as the Amur leopard. The Amur leopard is probably one of the most endangered large felines in the world right now. There are 8 species of leopard, and of course this animal represents one of them. And there are probably about 40 to 70 individuals in nature in the east side of Russia, close to China. And there are probably about 200 animals dispersed throughout the world in captivity. And so it's very important to be using this captive population to increase the total number of animals and then slowly reintroduce this captive population selectively into the wild. Megan is an Amur leopard who, when we were starting to have some problems, was about 13 years of age. She had a history of dystocia associated with delivery. And we made the decision to go ahead and do a cesarean procedure to save the life of the baby and maybe even Megan. The procedure went well. There were no real problems with it. And we made it an important note to monitor her behavior after recovery, because it can be very stressful to sort of wake up from a surgical procedure and also have babies on the side of you. We felt that she was, with these excessive amount of movements, not feeding the babies as often and as long as she should be, and that if we could decrease through a calming or relaxing effect her reactivity to just normal amount of stress, we could maybe improve the nutrition for the babies and just decrease her overall stress. So we administered the drug, and we noticed rapidly there was a change in her stereotypic movements, and that she did stay longer with the babies and successfully raised one cub. I think one of the best things about Zylkene, the benefits, is that there is no real toxicity to the product. There's no negative effects. And I think in certain species, such as the felines, there seems to be an obvious subjective effect with its utilization to decrease the stress, as to have a calming effect for our collection animals.